So let's talk just for a very short minute about the physiologic changes in sleep that accompany aging. And we do know that there are changes in circadian rhythm. And I often wonder, I hear that word a lot, and I wonder how many people even know what circadian rhythm is. But in Latin, it means around a day. Or how is your rhythm? What is the rhythm of your life, your sleep patterns and your wake patterns? So that's all that circadian is. Older adults are known to demonstrate a sleepiness about 2 or 6 p.m. And that may be one of the reasons that older people go to bed so much earlier. I know when my daughter comes home from school, she asks if we'll still be awake for dinner at 6 because she knows that I'd like to go to bed around 5 p.m. This is a part of a very interesting concept that we'll get into just a little bit, but I do want you to know that older adults may demonstrate that need, but also some of this may be just because when we're older we have time to nap at those times. We'll talk about that. It is normal for aging adults to have an increase in time until sleep onset. What does that mean? It just means they stay awake longer when they lay down in bed. And we're going to see there's about 5 reasons why that happens, but that is a normal physiologic change in sleep that accompanies aging. And it is normal to require as much sleep as younger individuals, but they divide up elders' sleep between nighttime slumber and daytime naps. And like I said, when I'm at work during the day, I'm not allowed to take a daytime nap. But if I'm retired, it's really easy for me to sit in that chair and fall asleep or to go lay down on the bed and take a little nap. And it's according to how much napping and how often we're doing this that may have the greatest effect on our sleep patterns. So, common causes for difficulty sleeping for seniors. These are the ones that are listed no matter what you read. I think that some of these may affect aging more, but I'm going to tell you I think it's probably true for all of us. One of the things is stress, and we think about, I have stress all day long with a job, I have stress with a child in college, you have stress with a child maybe in day school, all the issues that you're dealing with. But in elders, some of the things we don't think about, what is stressing them, is many times financial stress or worrying about their children. And I want you to think about this. Many people who are 90 years of age that are suffering stress worrying about their children may have a 70-year-old child, just a 20-year age span. And yes, their 70-year-old may be having more health issues than they are. We just don't think about all the stressors that come that are still there with aging. Depression. This goes on, and this is throughout life. We see depression in young people and older adults. What we need to think about in depression is it clinical depression? But one of the most common causes for depression, and it may be a reason for sleeplessness, is isolation. That they're not having enough activity, not enough motivation in their life, not feeling like they're needed. And it's very important if we work in a healthcare environment to understand how important activities are, how important religious services are to help prevent this depression. If you're a family caregiver, it's no different for the person that you're caring for at home. They still need to feel needed, and they need to have a lot of activity going on in their life. So this is one thing that we can look at with aging. Anxiety. We're going to talk about restless leg syndrome in a minute, but anxiety comes from being afraid of being alone, fear of being sick, fear of dying. There's so many issues that go on, but they're very common causes and things that keep people awake at night. Recent loss or trauma in elders is most likely due to the loss of a spouse, and we see some tremendously disrupted sleep patterns in seniors after the loss of a spouse. We also know, as we just said, that if you're a 90-year-old parent and you lose a 70-year-old child, that is a loss and a trauma that is no more diminished because of age. So these are very common issues that are happening. Medications that keep folks awake, we'll talk a lot about medications, but I think the most important thing that I can tell you is every med that you're taking, you need to know why, what is the best time of day to take that medication, and to know that every medication that you add on to your list of meds is a chance for an interaction that can cause sleeplessness. So I'll tell you that our next eye care series will have Carrie Allen, who is a pharmacist who deals in geriatrics, and she's going to talk a little bit about this with over-the-counter medications as well. and then we'll get into some health problems, and those are very clear, and we'll talk about that in just a second. Bet you didn't know, though, that the #1 most common reason for poor sleep in seniors is their environment. And this makes me laugh because I'm always honest with you all. I'm 61 years old, so I'm now a senior. I'm a dual member of AARP with my husband. And when I looked at this picture that was put together for me for this presentation, I almost died. Because I want you to know that I go to bed every night with not one dog on the bed, but 2. We go to bed with a TV screen, I don't know how many inches it is, but it looks like the Spurs players could jump in the bed with us. It's that close, and it's that bright and that big. The temperature in the room for the environment is imperative that you look at. We have a change in our core body temperature as we age up, and it does affect sleep. And then we talk about screens like what are you doing before you go to sleep. So if you're on the computer, I do that every night before I go to bed. I'm checking the last of my emails for the day and getting ready for the next day and looking at my calendar, watching TV, probably too hot in the room. I'll tell you that story in a second. Watching the TV, and then the dog. So as we go through this, you're going to hear more and more about environment because it's so important to create the right environment for sleep. Now that's when you're at home, because most of us don't have dogs in our bed at the nursing home or in assisted living. But if you work in a hospital or a nursing home and you're a caregiver there, I want you to think about the noises that go on during normal sleep times. The telephones don't stop. The call lights don't stop all night long. When do we do the floor repair and the buffing? We do all of that during the nighttime hours, which creates noise. We have lights on. I want you to know this is when the laundry carts are being rolled up. The dirty dishes are being taken away. I hope that if you are a family member or you are a caregiver in a facility, that you will stop and listen for those noises and see what can we do to reduce some of that during the nighttime hours. I love to tell people that as a nurse, and having been one for years, everybody wants to say that folks who work on 11 to 7 have the easiest of jobs because everybody's asleep. My rounds, and especially when I do quality assurance rounds, have always shown me more than half of the residents are up at night. They're on their call lights calling for pain meds. They can't sleep. They're uncomfortable. They're anxious. They're walking around. I have never been a believer that the night shift is the easiest shift. I think it's one of the most difficult shifts when you think about staffing. So let's be very cognizant of that.